Let's talk about the role of ultrasound in managing placenta previa during pregnancy. And let's define what a placenta is. A placenta is an organ that forms during pregnancy and is essential in providing food, nutrients, and oxygen to the growing baby or to the growing fetus in the uterus. When this placenta forms, it can attach itself at any part of the uterus. It can attach itself on the front part, what we call the anterior. It can attach itself to the back part of the uterus, what we call the posterior portion. It can attach itself to the upper part of the uterus, what we call the fundal portion. It can also attach itself in the lower uterine segment, what we call a lower lying placenta or a placenta previa. When it attaches itself in the lower part of the uterus, it can cause issues in pregnancy. One of the issues could range from the lower abdominal pain, it could go to the PV bleeding, it can even cause a miscarriage. So once a mother is pregnant at this particular period, especially after the first 3 months, and you'll start experiencing bleeding or lower abdominal pain, you will go to the hospital just to check what is happening. And when you visit your clinic, you might be advised to do an imaging technique, which is an ultrasound. And what you want to do is just to look at the baby, and another thing that is going to be the center of our focus is going to be the position of the placenta. We want to know exactly where this placenta is. So we want to know, is it a low-lying placenta? Is it formed down there? Is it encroaching on the internal cervical os? If it's encroaching on the internal cervical os, how bad is it encroaching on the internal cervical os? That's where we'll come up with grades from grade 1 to grade 4, just to make sure, or just to inform the medical team who are attending to you at the clinic, just to tell them how severe is this placenta previa. So at least if it's grade 1, if it's grade 2, if it's grade 3, if it's grade 4, depending on how bad it's covering the internal cervical os, we are going to give this information to the medical team who are handling you. And every grade, every severity of the placenta previa comes with its cost and comes with its own form of management, which you are going to be explained well at the clinic where you go for the antenatal clinic. So once you are told to do a scan, once you have these symptoms or these issues and you're told to do a scan, and maybe in your report you are looking at someone writing about the placenta, that is the reason why we report about the lower lying placenta or the placenta previa. So at least once you have this information, or once you are told to do a scan, kindly do it, because this information is essential. Because if you have a placenta previa, there's medication for it, there's medical management for it. If you have a placenta previa, there's medical management which you are going to be told and explained to in the clinic. And some of these things will even have maybe another, will also affect even sometimes the way you're going to deliver. So this ultrasound is a major tool. It's an essential tool, so that when you're doing this thing and when you're checking what the placenta is, when you're told to do a scan, to at least just to know exactly if you have a placenta previa, kindly go and do the scan, because this can save a life. It can save your life. It can save the life of the baby. And again, what I've always said, that ultrasound is a safe tool, painless tool, and that's what the information we get, like the information we get can be of essence, can be helpful to the mother and to the growing baby in the uterus. And placenta previa sometimes can be fatal if it's not diagnosed early. If it's not picked early, it can cause death. So once you go to this hospital and you're told to do this imaging technique called an ultrasound, kindly go do it. And I'm sure once you get, if this is going to be found on the scan, I'm sure you're going to be helped and you're going to have a healthy baby at the end of the 40th week. Thank you very much, and thank you always for tuning in. Thank you.